Okay, good afternoon. Happy New Year. Happy Monday. It's a snowy one out there, so I hope everyone's staying warm. Thank you so much for joining us. My name is Felicia Sprague. I am the regional manager of White House Dental, overseeing multi-site operations in Toronto. I'm a seasoned manager known for my focus on strong leadership, operational excellence, and prioritizing mental health. I am dedicated to shaping a workplace culture grounded in communication, innovation, and patient-centered care.
Hi, everybody. Happy New Year. Thanks for joining us today. I am Dr. Aisling Whitaker, a dentist and clinic owner in Toronto. Before earning my dental degree, I completed a PhD in psychology, and I've spent more than 15 years consulting with dental clinics and speaking at conferences on marketing, team culture, and practice systems. I'm the faculty member of Clearly Aligned, a comprehensive clear aligner education platform. And Felicia and I are the co-founders of Dental Hive, an app for finding dental jobs and hiring dental team members. We created Dental Hive to help clinics on the pain points of hiring, HR, and employee retention. We welcome you to join the app. It's free to join, whether you're tuning in from Canada or USA, and we have a big update coming this year, so we're excited for you to be part of it.
So today we'll be reviewing our goal setting guide for the year ahead so that you can start 2026 strong and make this the best year yet. We'll be chatting for about 30 minutes and sharing tools that you can start using in your clinic right away.
So whether you're joining us live or on the recording on YouTube, please grab a coffee and a snack, and we're going to jump in. Um, so why should you plan ahead and set goals for the year? So Felicia and I do this at the offices to enhance productivity, efficiency, and also team morale, which is a really big, important focus for us. So the first piece of planning that we recommend is looking at your schedule for the whole year and blocking off vacations for providers. So holidays, clinic closure times, personal calendar, education, and also operation meetings. So blocking off your schedule in advance for each of these things is critical so that you don't scramble a few weeks before or a month before. So let's go through each of these. So provider vacations. We like to send out a survey or even a text in our group text message to each team member to ask about things that they know that are coming up in their calendar for the year. So at this point, a lot of people have already started to think about family vacations. They also know about weddings, special events that are coming up. It's especially important for the providers, like the dentists, the hygienists, because their schedule gets booked up for 6 months ahead. So ask them now at this point, this week, like right now, while you're on this call with us, to the hygienist, to the dentist in the team, do you know times that you need to be away for that we can look at and see how we can coordinate that together? Felicia generally has a rule at our office that she approves everything if we can. So we really try and work around people's life so that they have work-life balance. But we do need to know ahead of time so that we can really plan for that and it's not a struggle or a stretch. We also like to block off holiday closures. So we don't open long weekend Saturdays. We need to block that off both in our Google hours as well as in our schedule. And any holidays that you know. So like we start to block off now for what we plan to be closed for next winter holiday, for example. We like to plan our continuing education. So we want to look at the main dates for big conferences this year to see, are there dates that the doctor's going to, the hygiene team, are there dates for the whole team to attend? We'd like to know what CE we're going to plan for our team this year. So each year for the hygienists, we look to see, is there a course that they could all take or a certification? Same for the assistants. So we want to look at the key websites, like, for example, our education partner, RDHU, is one of the big hygiene training platforms. So we want to look to see what have they got coming up that could be of interest for our team so that we can block them off appropriately. We like to look at our personal calendars, in particular on the management team. So Felicia and I and the other couple of managers within the clinic to look at things that we personally need to block off for, and also to always kind of see that there will be a manager around amongst us if some of us are going away. So we like to look at what our personal calendar looks like for the year. And I personally, as a parent, like to look at what are the PD days that are coming up? Do I have coverage for those, or am I going to take those off? I look at the school calendar to see, like in June, what date does he have, like his little graduation ceremony type thing, and then that type of thing. Because I want to block that off now. I want to be a present parent. So it's really important to sync all of that at this time of the year. Then we start to look at team education. So Felicia likes to plan whether it's a lunch and learn or half days or full days of training and have those planned out for the year. Maybe it doesn't have all the topics ready yet, but has the days set aside so that we know, okay, we've got these few sessions blocked for the year. Everybody knows about them. Everybody's scheduled to be on. They don't coincide with when lots of people are off. So that's why it's nice to get the vacations in early. And then Felicia blocks out operation time. So time for her and I to talk to each other, which doesn't happen on a week by week basis unless you prioritize it. We're like ships in the night running this business together. So blocking off time for the practice owner and office manager to sit down and review things. That could be office manuals, that could be financials, KPIs of the last few months, clinic protocols, what's working, what's not. Are there gaps for hiring? And really looking at that so that we are very, very well planned for the year ahead. So I recommend leading by example, encourage your team to take time off. We find that we are kind of open with our team taking time off. Obviously, they have a certain amount of paid time off, but a lot of our team have family that live overseas and want to go and visit them for extended time. It really promotes a positive work culture. As long as we can organize our schedule around it, it's positive for everybody.
Absolutely. And making sure that, again, like you said, lead by example. So make sure we're also taking personal time off, using our vacation time as well. It's so important. As an office manager, one of my core roles is just having a finger on the pulse of the financials of each office. So tip number two is know your numbers. Having a very clear picture of your clinic numbers and key performance indicators, your KPIs, and the system for tracking your progress will keep your practice on track and will truly help you grow. So, monthly reports, which KPIs are we looking at? We're looking at our new patients. So, we want to know how many did we get and where did they come from? This is going to help us decide where we're going to put marketing money and things like that. Production, so we want the total production for the month, but also per provider, your dentist, your hygienist. And then you want to break that down further into like per hour, like how much are we making per hour as well. Production and case acceptance for your top procedure. So we're a big ortho clinic. We do a lot of Invisalign. We also do a lot of implants. So what do those case acceptance look like? What kind of production are we getting from those? Accounts receivable, of course, every single month you should be keeping track of your accounts receivable. What is owed from patients? What is owed from the insurance? We also like to break that down further. Like, what do we have in terms of payment plans? So, what accounts receivables do we have that are doing payment plans? Because those are really important numbers as well. For hygiene, you want percentage of time filled, also percentage of patients rebooked. Google reviews, so number of reviews, how many, 5 stars did we get? How many lower stars did we get? We want all the numbers. All of that is going to help us really grow and see what areas we can, we get feedback in. And then also schedule retention. So number of no-shows, last minute cancellations. We want to make sure that, we know what percentage of our schedule is being filled. And then after, we want to identify areas for growth. So how do we reduce no-shows? Maybe that includes automatic reminders, having credit cards on files if you're going to charge for a no-show fee or short notice cancellation fee. Prime appointment slots for consistent patients. We find this is a really great one. So, that first appointment of the day, you will not really hold those for your amazing A+ patients that are consistently showing up, not canceling last minute, not missing appointments, etc. Sometimes for new patients, you don't always know what they're like. So keep it for your regular patients and those evening spots as well. Comprehensive exams. So, we do a comprehensive exam when we get a new patient, but then every 3 to 5 years, depending on your clinic protocols, who you need to identify who is due this year. Your strategies for increasing Google reviews. So look at what you're doing now. Do you have the front desk ask each patient as they go out? Do you have an automated system? So just looking and kind of defining those protocols and how you're going to get more feedback and get more reviews on Google. Review your fees for top procedures. If you're doing a lot of, root canals or a lot of crowns, are you comfortable with the fee guide prices? Do you want to add a little bit more on top of that? So just kind of looking at those top procedures as well. And then utilizing technology. So you want to be encouraging, intraoral images, scans in the hygiene appointments, just depending on the patient. And then financials, again, payment plans are huge. So you want to look at the payment plans for the accounts receivable of patients, depending on if you're using in-house or a third party. So you want to kind of combine all that information. And then next, you really want to set SMART goals for yourself. So, what are SMART goals? SMART goals are specific, measurable, achievable, relevant, and time bound. So, you want to ensure that your goals are SMART. So, for example, increase patient retention by 15% by Q3 2026. So, at the end of Q1 and Q2, you're going to keep these in mind, keep your goals in mind, double check them, say, are we on track? Is this something that we might need to adjust beforehand? And then team alignment. You want to share your goals with your team and involve them in setting the benchmarks. They're the ones that are going to really help you achieve your goals. So they need to be aware of exactly what your goals are. So discuss expectations during team meetings. You want to celebrate milestones together. This is a huge one because it's really going to bond and build your team. And then if they don't know your goals, then they're not going to be able to help you achieve them. So just really make sure that your team is all aligned on what your goals are. And then just a pro tip, focus on small incremental improvements. For example, reducing patient no-shows by 5%. Even just that little number can lead to such significant gains. So it doesn't have to be a monumental number, just start slow. And then every quarter, like I said, just go back and reevaluate your goals.
And I think the thing is, as office managers or dentist owners, you may be tracking a lot of this already. We really like to have a single page for each quarter. Like we really want to have that ability to look at things side by side and make that comparison. And because without that, it gets lost in the numbers, right? You want to have a few measurable things that you really want to focus on. Sit down, the owners, the office manager together, decide on what are our core things we want to grow this quarter or this year, and have that report and that sit down together to review them each time. So tip number three for goal setting for the year is team training. One of the biggest things that has changed my work life is the ability to delegate. And delegation only works if you're appropriately training that person that you want to do that job. Because they don't have your brain, they can't download that information and just apply it. So streamlining your workflows and training staff can really reduce staff for you, or stress, not staff, increase your staff for you. So some of the things that we have trained our team on that have been really, really amazing is performing a next day and 1 week audit. So we confirm all the lab work. We confirm all the consent forms. We use a lot of consent forms and a lot of, retainer consent forms and all this kind of thing. So all forms are prepared for tomorrow, and for 1 week out, we're looking at that and sending them if they haven't done them yet. That insurance is all up to date, appointments are confirmed, that there's nothing that you're going to come in on that day and be like, oh, whoops, this was booked for the wrong length of time. So we really want to make sure our appointment times are realistic, account for complexity, and we really try and make things a bit easier for the dentist by spacing out very high effort appointments. I find it very, very difficult if I have back-to-back, very difficult dental treatment to do. So it's important to kind of communicate that with your team. They didn't realize, for example, my husband does a lot of surgery and implants. They were like, yeah, he'll love these back to back to back to back to back. And he's like, I'm going to pass out. This is so difficult. Whereas another provider might love it that way. So I think the important thing there is chatting to each other and saying, what do you want to have back to back and what is very hard for you back to back? Do you even have the instruments to do these procedures back to back? Another big thing that we looked at last year and we continue to look at this year, AI came along. So we're using AI tools a lot and we will continue to research what dental AI tools are available or are working well. So automate where possible, invest in tools that work with your software for patient communication, billing, appointment reminders, these statistics that we're saying today, like a lot of our softwares can have that built in now, and there's more and more coming, like dental receptionist, AI being able to screen calls so that your dental receptionist has less calls they need to pick up. They can focus more on the patient in front of them. There are so many things like that that are coming that could really help all of us. So keep a finger on the pulse of what's going on and keep in the Facebook groups and looking at what other people are trying out, and book meetings with these softwares so that they can present them to you, do a demo with you, and see if it's the right thing for you to onboard at this time. Inventory management's always a tough one for every office. Every office does it not badly, differently. We do it badly, but differently. No, I don't. So really figuring out a smart way to track supplies, avoiding things expiring has been a big thing for us in the past. If different dentists use different composites, let's say, for example, setting up automatic reorders so that you're doing things in bulk and you're avoiding shortages or overstocking too. There's nothing worse. So really looking at the rate at which you have to order certain things so that you can be smart with the financials and maybe the ability to save up before a dental conference so that you can buy things then and you know what you need and you know how many you'll need for like a 6-month period. So we like to kind of do monthly efficiency audits to figure out these bottlenecks and really look at our schedule and look at the automation. And I like my team to bring ideas to me too. So I'm always saying, hey, if you hear something from another officer or a friend or anything like that, pitch it to us because we're always interested in increasing our efficiency.
Absolutely. Okay, tip number 4. So update office manuals and certifications, update all your documents. This doesn't need to be done like, this week. This is definitely something that can be done this month, is just ensuring that your team has clear guidelines to follow, reducing confusion and increasing consistency. So you want to review any existing manuals, audit all your policies, procedures, just so we can ensure that they reflect the current industry standards and regulations. You want to audit your certifications and memberships. Everyone usually renews everything, all their licensing back in December for the new year, so for 2026. So request the updated licensing certificates for all your providers and confirm what is due this year. Are you doing CPR this year, BLS? WMIS should be done annually. So just confirm what certifications need to be updated this year and plan for that. You want to incorporate feedback, so involve team members in updating manual to address real world challenges. So what issues popped up in 2025 and how can we address that and create procedures to better serve our patients, better serve our staff in the new year. And then a thing that we did a few years ago, which has just changed everything for us, was create digital access. So we started storing all of our manuals in a cloud-based system, making them accessible anytime. This is great because we can work on them, from different computers, from different offices. We can all contribute together. And it's not something that is printed hard copy in each office. It's something that we can edit when needed, that all of our staff can access anytime they need to double check something. And one little tip that we have is in your team meetings, highlight any changes so that you can ensure all staff members sign off on the updated policies and they know exactly what has been changed or updated this year.
Okay, so tip number five is focus on team wellness. This is a huge one for Felicia and I. I think we both went through a phase after the pandemic where we were rearing to go, and then we got into burnout, probably together, at the same time, and then we were like, whoa, we need to take a step back and really focus on personal wellness and team wellness. And Felicia's big on leadership, and our next Zoom is going to be on leadership, but we know that happy teams lead to happy patients and happy managers. So it's very important for us that a leader focuses on team wellness in order to allow their team to flourish professionally and for the clinic to flourish financially. Like it's a really, really core belief that we have. So what does this kind of bottle down to in a dental office? Training and continuing education. We know that our team, when we do surveys to see like how do they like to be appreciated, the number one is they want to be invested in. They want to be invested in their own professional development. And that comes back to the clinic because then the more that they learn, the more they know, and the better they're able to treat your patients. So we like to set goals for what that education looks like for our different departments each year. So we'll set goals for specific course or specific certifications on an individual and group level. We'll look at workshops and courses, as I mentioned earlier. When are they coming up? Does this work for everybody? Are there multiple days to choose from, and so on? And we allocate a budget based on the level of seniority of that person, um, and what their role is in the clinic, and what their professional development will look like over time. For certain high cost certifications, we'll sign like a document kind of acknowledging that we're investing in you. And then this means that you'll commit to working at our clinic for whatever period of time that might be. So it could be like 6 months, could be a year, it really depends on the program. If it's just a one-day course, obviously we don't do that, but if it's a certification or diploma type course. And what this means for me as an owner is that I'm surrounded by professionals who are really top of their game. And that brings me so much joy. And so then it leads back into my own personal wellness where I'm at home, thinking of the team and thinking like how awesome they all are. We like to plan for the year also in terms of check-ins with our staff. So we like to know what is that going to look like. Are any of them due for like an end of probation meeting? Are any of them due for a annual check-in? So we do check-ins every year. And we like to have those in the schedule ahead of time so that they know when that's coming up. We like to celebrate wins. We like to do a lot of feedback, and you'll see in some of our other webinars where we really talk about that side of things, like the team feedback. We really like to send these out monthly and quarterly to really know how our team are getting on and really look at that feedback together when we meet as a management team. And then we also like to review our team retention strategies. So Felicia created an amazing framework last year for how are we going to reward our team and what does that look like? And some of these things are financial rewards and also things like celebrating their birthdays or whatever. But how does it look like in terms of what is the plan? Because otherwise, you can kind of spend unknowingly and maybe different amounts on different people accidentally. It's good to have it all in a spreadsheet and have a knowledge of what your plan is for the year. And that way you have it really under control and you have a reference document to go back to. So we do have a wellness survey that will drop in the chat. And those of you that are watching the recording, this is available for free inside the resources section of Dental Hive. And we recommend distributing this quarterly and then reviewing it at the managers meeting. So we usually do it about 2 weeks before the meeting so that we can look at these bits of feedback in the meeting together.
Yeah, absolutely. We find it helps so much just to kind of plan what we want to do next. So those wellness surveys are amazing. So our last tip number 6, is innovate with technology and marketing. So you want to stay ahead of the curve with modern solutions. So review your technology annually to identify things that need updating or calibration. Invest in technology, upgrade your imaging equipment, patient management software if needed, or integrate teledentistry services, which we talked a little bit about. Just do your research and see what works with your current system, what is best for your office, what you need. Get calibrated, so check your renewal dates and obligations for calibrating equipment relating to radiology, laser, sedation, medical emergencies, water lines, etc. Refine your online presence. So ensure that your website and your Google business page is up to date with current team members and treatment you offer. Again, going back to one of our first tips, double check your Google hours. You want to make sure that any days that are random, that you're closed, that you update that in Google, just so you don't have patients calling or showing up because they think their appointment's on the wrong date. That's a big one. And then you want to engage on social media. So post content that highlights your practice's values, top treatments, highlight that you're accepting new patients, do team introductions and community involvement. Use analytics to measure the success of your marketing efforts and then adjust every quarter accordingly.
So some final thoughts. Setting goals is not just about achieving benchmarks. It's also about looking at your team and fostering positive and sustainable environment. By planning thoughtfully, you can really prioritize your personal and also team well-being. We really hope that 2026 can be your most successful year yet. Thank you so much for joining us. I'm going to go ahead and drop a written version of this guide into the chat, and we will make this available inside of the resource section of Dental Hive in the coming weeks. And there are many other guides and helpful resources in there, so please do check it out.
And if you enjoyed this webinar, we hope you'll join us for our next live, which will be in March, where we'll be discussing using emotional intelligence to become a better leader. So we'll be live again on Zoom on Monday, March the 9th at 12 p.m. Eastern Standard Time. So happy New Year, and we will see you then.
Bye.
Bye. Thank you.